afternoon, everyone. Thanks for joining us for this Thursday's COVID-19 press briefing. Today, Orange County Mayor Jerry L. Demings will discuss his recent conversation with federal leaders at the highest rank of government regarding COVID-19 and vaccinations. The mayor will also talk about Orange County's effort in assisting the state with the vaccination process, including a new initiative to assist our most vulnerable citizens. The mayor has information regarding COVID-19 cases at the Orange County Jail and other details as well. Orlando Mayor Buddy Dyer is here to discuss mental health and efforts to keep downtown Orlando healthy and clean. And Dr. Raul Pino is here from the Florida Department of Health in Orange County to discuss details on the vaccination process and other COVID-19 information trending in our area as well. A note, we do have other county leaders here that we will call upon to shed additional light on these topics, including individuals from the Orange County Public Schools. We have a lot to cover, so please, one question per reporter in this session. All speakers will remain for additional interviews once we complete this portion of the press conference. We begin with Mayor Demings. Mayor?
All right. Good afternoon, everyone. Thank you, Dr. Williamson. We brought a lot of backup today, so we do have Dr. Vasquez from the Orange County Public Schools. We have Mr. Hickling, who has joined us with links, as we will talk about a new links initiative shortly. We have Dr. Yolanda Martinez from Orange County Health Services. We have the Executive Director from the airport, Mr. Phil Brown. And we have Chief Quinones from Orange County Corrections. So we're going to weave some things into our briefing this afternoon, and it may require additional communication from those who I just identified. Just as a reminder for the Spanish-speaking media, we have the ability to translate, and we have Ms. Ilia Torres, who has joined us, who will primarily do that for those who do not speak Spanish. We are joined also by Orange County Commissioner Myra Uribe as well. And with that, I'm going to go ahead and get started. Yesterday, I did have the privilege of being on a nationwide WebEx call with the Vice President Kamala Harris. The Vice President met with members of the African American Mayors Association from around the nation. It really was a good call and included candid conversations about vaccine distribution. The biggest takeaway I learned was that the vaccine we should see increased distribution within the next few weeks. They are projecting that states and local governments will be able to see improved visibility and transparency with the projected supply in order to plan better for distributions. There was great concern expressed about health care inequities, and there was an introduction of members of the Health Equity Task Force that the White House has created at this point. The government is also looking at distributing the vaccine directly to local family health centers soon. They're doing that in an effort to improve access to minority communities. I want to also share information with you about something that we are doing in partnership with the Department of Health and Dr. Raul Pino and the state. The Department of Health's appointment portal for the Convention Center will be opening on Monday, February the 15th at 9 a.m. for seniors 65 and older to make reservations or appointments. So we ask that for more information, you can go to our website at ocfl.net/vaccine now and register in advance so that you can get online and make the appointment on Monday when it opens up at 9 a.m. In order to qualify for a shot, you must prove that you are a full-time or part-time resident of Florida. We also want to share with you that we just learned a few minutes ago that there are 42 public sites in Orange County that will be administering shots very soon. Again, we will share information on our website at ocfl.net/vaccines. We have more good news for seniors who are unable to drive themselves to the Orange County Convention Center vaccination site. There are now transportation options for those individuals thanks to a partnership with Links, and you'll hear more about that. But residents who are 65 and older who have obtained an appointment for a COVID-19 shot and do not have a way to transport themselves to the convention center site can call 311. That is our government services free line 311 to find out how to qualify for the free ride. 311 will coordinate with the Office of Emergency Management in Orange County to find transportation options for vulnerable seniors in need of a ride to the site. Links needs at least 48-hour notice prior to scheduling a ride through this effort with the Office of Emergency Management here in Orange County. When the ride is scheduled, the Links driver will pick up the rider at their residence and drive them to the convention center. The Links driver will then wait in the vehicle line with the senior through the entire vaccination process and then take the rider directly back to their home. To qualify, the senior must be able to prove they have a valid vaccination appointment. A family member or caregiver may also ride along with the senior. The wearing of masks is mandatory. This site is for the convention center only. This is for the convention center site only. Links can transport qualified seniors from Orange, Osceola, and Seminole counties to the convention center site. If you live outside Orange County, 311 can be accessed by calling the full number here in Orange County. Orange County is coordinating this, and the full number is 407-836-3111. 407-836-3111. But if you're within Orange County, you only need to dial 311. Also, I just minutes ago, I got off a nationwide conference call facilitated by the White House IGA office, and they reiterated the president's commitment to getting 300 million shots in the arms of Americans within his first 100 days, and they promised a substantial increase in supply. Again, they promised more visibility and predictability of when the supply and inventory will be made available to the state and local governments. Let me just update you on where we are with the vaccinations within Orange County. Nearly 40% of Orange County's residents aged 65 and older have received at least one COVID-19 vaccine shot at this point. That's 64,479 individuals, which is about 39.9%, or exactly 39.9% of our senior population. And that is according to the Department of Health. Based upon Orange County, of the 1.4 million or so residents that we have, 161,327 residents are estimated at being 65 or older. Since the start of the pandemic, there have been a reported 108,209 COVID positive cases in Orange County. 108,209 positive cases of COVID-19 within Orange County. Sadly, once again, 1,015 residents have died as a result of the novel coronavirus here within our community. On to other news. When we look at our 14-day rolling positivity rate, Dr. Pino tells me that it is now 8.1%. That is down a full 2 points from 1 week ago today, when it was 10.2%. As a reminder, we will continue to offer free testing 7 days a week at Barnett Park through the end of the month. I also want to address the number of COVID-19 cases at our jail. I know that there's some interest in that. Right now, there are 83 inmates who have tested positive for the coronavirus. Out of the 83 who have tested positive, 68 of the inmates are asymptomatic, 15 are symptomatic. No inmates are requiring hospitalization at this time, And since the start of the pandemic, we have not seen any of our inmates die as a result of the COVID-19 virus. That's different from many other jails here within Florida, and that's different from the Florida Department of Corrections. All of the affected inmates are being kept away from the general population and are being monitored by healthcare professionals as they recover. In addition, 15 of our staff members who work at the jail have tested positive. In response to this situation, we have restricted visitor access and inmate movements. We also have a plan in place to vaccinate inmates who are 65 and older once we get available vaccine supply. In addition, we offer free testing to all inmates. Since the pandemic began, we have administered nearly 8,700 tests with 260 test results pending. Since the first known case at the jail in June of 2020, the positivity rate of those tested is 3.9%. Again, Corrections Chief Louis Quinones is here should there be any additional questions concerning that. As we share more information about COVID-19 vaccination sites opening up, it's important for everyone to know the facts about the vaccine. We must all be wary of false and potentially harmful misinformation on the internet or hearsay from gossip. For example, many people think that if they have already had COVID-19, they don't need the vaccine. That's not true, right, Dr. Pino? That's not true. You do need the vaccine, even if you have tested positive previously. Or if you've had your vaccine, you don't need to wear a facial covering or mask. That's not true. For these and other myths, you can visit our webpage at ocfl.net/vaccinemyths. And now I'm going to pass it on to Orlando Mayor Buddy Dyer.
Thank you, Mayor Demings. If you can believe it, we are approaching the 1-year mark since the virus first impacted our community. And I know it's hard to believe that the pandemic has gone on so long. I think those first few weeks in March, we thought summertime we'd be through with this. But there is hope. I see our dedicated healthcare professionals and first responders continue with our vaccination and testing efforts. And I see how much interest there is from our residents wanting to get the vaccine. So it's good to be hopeful. But I understand a lot of people are suffering from pandemic fatigue, something I've experienced myself, quite honestly. And it's been a long road for sure, but it remains important that we stay the course. And if we need extra help now, don't be afraid to ask for it. It's important right now, in addition to our physical health, that we take care of our mental health. Today is National 211 Day, and I want to remind residents that assistance from the Heart of Florida United Way can provide. If you need to talk to somebody or reach out for help, you can call 211. They're here for you, and we'll get you connected to support programs to meet the needs, including mental health assistance, food, and financial resources available in Central Florida. So I want to thank Heart of Florida United Way for all the work that they have done. Another way to break from pandemic fatigue is by safely enjoying outside activities. I've talked about that before, but I want to highlight a few things and new things about downtown. Our arts and culture partners and venues have created safe ways for you to be entertained outdoor, whether it's enjoying live music at the Front Yard Festival at the Dr. Phillips Center, or the front porch at the Plaza Live, or watching a movie on the East Lawn at Lake Eola Park. Those are 3 great examples of things that you can do safely. Our downtown team has implemented several initiatives to welcome patrons back safely and to keep our local economy moving forward. Throughout the pandemic, our downtown clean team has been diligently sanitizing high-touch areas since the very beginning. To increase our efforts, we recently added 2 new ATVs to the clean team, and we'll be adding 4 more in just a few weeks. Each of those ATVs holds a 25-gallon spray tank, which the clean team uses to spray high-touch areas such as bus stops, bike racks, stair rails, and waste bins. So we are being diligent in providing a safe and enjoyable environment to everyone in our downtown. And lastly, yesterday, as part of our continued education effort, we started installing pole banners throughout the downtown that emphasizes doing your part in slowing the spread, masking up, watching our distance, and washing our hands. And actually, I have one more thing that is now lastly. I want to highlight an item that was on City Council on Monday, and that was the City Council leveraging some of our Federal CARES Act funds to support the Westlake Partnership Food Distribution Program for low-income households who have been impacted by COVID-19. Funding that we are giving to Westlakes will allow it to host 6 of its bi-monthly food distribution events and weekly food deliveries for 6 months to seniors in 30 different facilities. COVID has impacted so many, and we're grateful for not-for-profit partners like the Westlakes Partnership. With that, thank you, and Dr. Pino.
Thank you, Mayor. Thank you, everyone. I'm going to skip some of the data that Mayor Demings already offered to be able to provide you some data that I have. So the recovery rate continued to be 95%, so we are stable on that. And the number of deaths has risen to 1,015. The average age is 6 to 91, with a median age of 83. And 9 were female, 6 were male. Race, 2 blacks, 1 other, 12 white. Ethnicity, 2 Hispanic, 12 non-Hispanic, and 1 of unknown. 8 had pre-existing conditions, 7 didn't. 14 of those, the death was in January, which probably will be the month to the most deadly if we can recalculate that. And 1 is from February. 6 of all cases, that's about 40%, were residents of long-term care facilities. With the administration of vaccines, we have administered in our county, in all areas, 167,563, and our residents that have received any vaccine, 148,358. The total of non-residents that have received vaccines are in our county facilities, 19,205. Again, with this number, keep in mind that many of these individuals do work in Orange County but reside in other surrounding areas. Now, 6.73% of all county residents are partially vaccinated. That means they have received at least 1 dosage. And 39.9% of all residents above 65 years old have received the vaccination. Can we have the data? So this data, so the question is the vaccine working? So that's the question that everyone asks. And it's difficult to say at the beginning of the phases that we are experiencing. But we were able to calculate. Thank you. What we were able to do was subtract all 65 years old, the entire population, the over 160,000 of the county, and look at who has been vaccinated in that specific population, and then how is the pandemic moving in that specific segment of the population that is getting the highest number of vaccines. In blue, you will see the number of cases by the year week. So 1 is the first week of this month. In the different lines, you see the vaccine. The dip that you see in the vaccine that day on week 4, that was a Martin Luther King Day, that many of the facilities were closed. So that's why you see that dip. But it clearly illustrates that as we increase the level of vaccination in that group age, then the number of cases are decreasing. We also were able to establish correlations, mathematically, analytically correlations, and they have some significance. It's too early. It's 0.6 for those who knows data. It's too early in the process as we go, but it's starting to show significant improvement in the infections among that age group, or 65 years and older. And sorry, adolescents, so my voice is changing. So here is to say, the more people we get vaccinated, the faster that we move through the vaccination process, the faster we are going to recover, and the faster we are going to control this pandemic. This has a lot of significance because now we have 10 cases, at least, we should say, at least 10 cases of the variant in our county. And one of those cases specifically is a student of one of our local colleges. So this is to say that this is the time that we have really to reinforce protective measures. And this is also the time for restaurants and bar owners to strictly adhere to CDC guidelines. Because if this variant spread here the way that it's spreading around everywhere, in 4 months could be the dominant variant. And it transmits very fast. And the more opportunity that we give to the virus to mutate, the more likely is that it could become resistant to some of the vaccine, or at least decrease the effectiveness of some of the vaccines. So that's why we are trying to move so fast in the vaccination. The mayor mentioned to you the outbreak that we have in our county jail. And the surprise about this is not that we have an outbreak, is that we didn't have that many outbreaks during the pandemic in the county jail. Because around the country and around the state, it has been, jails are really a petri dish for any infectious disease. But really, our county jail has done a magnificent job, and the county health systems as well, in trying to contain the pandemic. And I'm pretty sure they will contain this outbreak. We are fully engaged. They are great partners. We have suggested a couple of things, but everything is in place. It's a pandemic environment. This virus is going to squeeze somehow, somewhere, even when we do everything, because you just can't see it. With that, I want to encourage people to wear the mask, wash the distance, continue to wash your hands. Bring your second QR code for the second dosage, and for the link initiative, we will talk to links so that they don't have to come every day that many times, but we can set up a time where you can bring everyone that has an appointment that day so that it's easier on everyone. But we will talk about that and set it up that way. With that, I will answer any questions that you may have. Oh, sorry. I have to introduce Dr. Maria Vasquez, the Deputy Superintendent for our school system. Thank you.
Thank you, Dr. Pino. I'm happy to be here this afternoon on behalf of Superintendent Barbara Jenkins. I want to provide an update on and share some initiatives for our students in the upcoming months. As you know, we currently have approximately 114,000 students that are back face-to-face in 202 schools. That's about 57% of our total population. We always like to remind our parents, students, and staff to be extremely cautious when it comes to social events or gatherings for children as well as adults. During the pandemic, remember, exposure to the virus does not only impact the individual, but can also impact many others they come in contact with, including our employees and those who are especially vulnerable due to age or health issues. So we will continue to emphasize social distancing, mandatory wearing of face masks, and frequently washing or sanitizing hands to help keep our schools safe. Remember, periodic breaks from wearing masks are provided while maintaining appropriate social distancing during lunch and outside. We know some of our students have struggled during the pandemic academically and emotionally, especially those that have been learning from home through our Launch Ed model. We respect any parent's decision to keep their children at home, but strongly recommend that students who are struggling switch to face-to-face learning in order to receive additional instruction. Our district academic team has created multiple extended learning opportunities for our students to address. We are going to have a new summer schedule. This summer, the district will observe a 5-day work week rather than our usual 4-day work week. All district offices will be open for normal business hours. Schools will be open 5 days a week, with the exception of the July 4th week, Monday through Friday, July 5th through July 9th. Until the coronavirus health and safety protocols change, any visitors will require an appointment before visiting any office or school. An expanded comprehensive summer school program will be conducted at each of our Orange County Public Schools to help strengthen academic performance for students that have experienced learning loss through the pandemic. Summer school will take place 5 days a week during the months of June and July, with the exception of the week of the 4th of July. In addition, the district is offering spring break camps at select schools. The spring break program's structure and length varies by school and will be featured on our district website. We are also offering some extended learning opportunities during the summer for our most fragile students, those that are ELL, second language learners, and students with disabilities. Our focus will be on the students that have experienced learning loss or are performing below grade level. Our goal is to offer opportunities a full day, being able to interweave art, music, and physical education in order to engage our students. Meals will be provided for all of our children. Transportation will be provided for those students that live outside our 2-mile radius and or our normal bus riders. Registration will be made available through schools, and parents will be notified regarding their eligibility to participate. Students with disabilities will discuss plans of their summer options through the IEP process. We encourage any employee or any parents that have concerns about COVID-19 cases or quarantines to contact their school or their principals. We are also encouraging all employees and parents to review our most recent version of the COVID-19 Health and Procedures Manual to ensure that the learning and working environments are safe. We want to remind all employees and parents of our students that if they or any member of their family has any COVID-19 symptoms, are awaiting COVID-19 test results, or have tested positive for COVID-19, to please stay home. Thank you. I will now turn it over to Mayor Demings.
All right, thank you, Dr. Vasquez. That's good information that you shared. Excited for our children, for that increased educational opportunity to come in this summer. But let me also address something. I misspoke earlier. There are over 300 million Americans, but the Biden administration committed to getting 100 million doses in the arms of Americans within the first 100 days. So I just want to clarify that. But with that, we'll open it up for any questions at this time.
Hi, this is Nikki Zizazo with News 6. My question is for Deputy Superintendent Maria Vasquez. With this new change that's being made to summer school, how will the district pay teachers for the summer? What's the plan for that?
Teachers during the summer have always been paid their daily rate of pay. That will continue, and we will be using federal dollars to help pay for not only their salaries, but all of the services and resources associated with summer school.
Questions for Dr. Pino. This is Sharon Stone with News 13. There's new guidance from the CDC about double masking. What are your thoughts about it, and what should people need to know at this point?
So I haven't read it yet. they are recommending that in some cases double masking especially will increase effectiveness against these variants that is most transmissible than the others. It adds layers, and in some cases, some masks are already layered. So it all depends of the type of mask that you're using. Some of the masks that we have, I think the one that you have has 3 layers, and there are others that just have one single layer. The neck heights that people are using are not that effective of that fabric. And surgical masks are the least effective. The plain paper surgical masks with only one layer are not as effective as the 3 layers. So any type of layer that you add to it, of course, increases the chances that the particles are trapped before they get to you.
Lara Greenberg, Fox 35. This question is for Mayor Demings. There's been some chatter today, reports that the Biden administration is considering a travel ban domestically with Florida because of the high rate of the UK variant here. And I'm just wondering what your thoughts are on how this would impact Central Florida, especially economically with our tourism here, if this were to go into effect.
We're certainly going to monitor very closely any travel bans because it could have some significant negative impacts on our local economy. I kind of anticipated that there may be a question in that line, which is why I asked Phil Brown, the executive director from the airport, to come. So, Phil, come on up. You can talk about what you're hearing about the potential travel ban, either domestically or internationally. He can give you a bird's eye view of what is happening with our airports and other ports of entry.
Thank you, Mayor Demings. Good afternoon. I have not heard anything about a travel ban. There's been a lot of discussion. There's a Miami Herald article that was published this afternoon about domestic testing. As I understand it, a group of folks in CDC, the Centers for Disease Control, are considering that. I think the U.S. Travel has been quoted, and just full disclosure, I'm a member of U.S. Travel. Our airport's a member of U.S. Travel. There are some concerns about implementing a domestic testing program similar to what's already in place for international arrivals into the United States for a couple of reasons. Number one, that testing will require about 42% increase in testing capacity. That has to affect the efficacy and the availability of the community testing that's already proven very effective. I think the other issue that we see is you've got vaccines rolling out, and at this point I'm not sure the efficacy of a domestic testing when you're trying to get resources out and get vaccines distributed through all parts of the country. So I think the questions we have are more than the answers. I think we want to engage, we want to get the full information, but those are the major concerns that we see right now with any kind of domestic testing capability.
Amanda Dukes from Channel 2, and this question is for Dr. Pino. Dr. Pino, I was fascinated when you showed that graphic, and I think for the first time today I heard you correlate the number of vaccines we're getting out into the community with a drop in positive COVID cases in that 65 and over age category. It was a pretty dramatic drop, and we've only vaccinated about 40% of that population in Orange County. So I guess my question for you is, are you surprised to see how effective just even that first shot seems to be? What does it tell us about that?
No, I was pleasantly surprised that we can see it in the data this early. We suspected that it would happen based on the effectiveness of the vaccine. Even with first dose, is about 80%, a little bit over 80%. So we have always encouraged everyone to at least take, when you have the opportunity, take the vaccine. And but it's really nice to see that drop. And although we have seen the similar drop also in students 5 to 17 years old, there has been a significant drop in that group as well, and that group is not getting vaccinated. So I think it's a combination of different factors. First, we are over the hump of the multiple holidays, and the vaccine is in place. And the vaccine has been effective because isolating these 65 years and older, that are the group that we are vaccinating the most, demonstrate that that's the case. So, pleasantly surprised, quite early surprised, maybe a Valentine gift for everyone, that there is light at the end of the tunnel, that we can do this. We just have to hang a little bit longer because it's happening. Now, remember, there was also an announcement today that the vaccines is going to be available for the entire population earlier than initially expected. They say today in the news, maybe in April, will be available for most residents. So we may tackle this even before that we thought.
Edgar Carrillo from Telemundo in Spanish, Dr. Pino. Mi pregunta es sobre la nueva variante. Hace 7 días exactamente conversamos sobre el primer caso y hoy tenemos 10. Quisiera que nos aportara un poco más de información sobre estos 10. ¿Están relacionados con aquel primer caso? ¿Es community spread? ¿O cómo se han dado estos nuevos contagios?
So the question in Spanish was about the UK variant that we have seen here, and how can I explain that we had one a couple of days ago, and then 10 a week later. La respuesta es no sabemos si hay relación entre estos grupos de personas que la han tenido y no están relacionados con el primero, que sepamos. Una de las personas, también la novia, puede ser que haya adquirido también la variante, pero no tenemos suficiente data para saber cuál es la relación entre ellos. Mira, la realidad es que todos estos casos son retrospectivos, porque cuando nos llega el resultado, sospechamos que es el caso, mandamos los análisis, y la verdad es que deben haber mucho más de 10. Para serte honesto, tienen que haber más de 10 en nuestra comunidad. Si el 25% de las personas son asintomáticas, pues esa es la realidad. 10 que sepamos, hay muchos más. So the answer in English was that these cases don't seem to be related. As much information as we have, they don't seem to be related. I think the big question for us is, has any of those cases been locally acquired? And we suspect that that's going to be the case. Remember, all these cases are retrospectively. We learn about the case, 3-5 days later. And as we said to you, we don't think that it's only 10. We think there are more. We just have found 10. But it will continue to spread if we don't take these measures and these steps and continue to increase vaccination. And at some point, we will be talking about hundreds.
Dr. Pino, this is for you as well. Lauren Seabrook, Channel 9. You mentioned one of the people who has been found to have the UK variant is a student at a local college. Can you say which college, and can you say if there's any measures they're taking outside of normal COVID-19 precautions?
Well, I cannot mention the college, the place, because it's only one person. It would be very easy to identify. And I don't know any extra precautions that the college has taken. We are in the initial stages of talking to them. But what I can say is the student doesn't reside in a dorm.
Steve Hudak of the Orlando Sentinel, and I have so many questions for everybody, but I'll stick to one, okay? This is for Mayor Demings or Dr. Pino or Mayor Dyer. How's that? It sounds like Walmart is operating under different parameters than the federal government or than the state government. The state had said, let's stick to 65 and older. They seem to have on their website that if you have underlying conditions, you can be younger. Can you guys offer any clarity for that?
So you have seen some difference between what the state has in place and Walmart. because the Walmart is a federally program. It's federal. So the feds are sending the vaccines directly to these locations, the ones that are going to participate, that the mentioned mayor and the locations will be available in the county website. What you have seen at the Orange Convention Center are directed from the governor, who had decided to change the priority order that was recommended by the CDC. So that's why those changes. But again, it also happens to be that our hospitals are receiving doses from the state to work in people with pre-existing conditions, even if they are not 65. Also, I think that there will be, I think that we'll be adding new categories to the state permissible individuals to get vaccinated pretty soon. As for example, we are reaching close to 50% of the estimated of the population. So at some point we need to get new infusion of people to be vaccinated. So we are expecting that pretty soon.
I'll add something to it. I'm looking back at my notes from the call immediately prior to me coming down for the press briefing. And this was a call that was with the White House IGA office. And on that call, we were told that with the federal distribution, there are 40,000 pharmacies across the country that will be receiving direct shipments. Within the coming months, they're going to gradually ramp up. And what we were also told was that it appears that initially they will have some 300 doses at each of those locations. And we can see that beginning to happen in terms of appointments as early as next week. So I share that with you. In terms of who will be eligible, they really didn't get into that on the calls, but it very well could be those who are defined by the CDC guidelines as being vulnerable populations. That part was unclear. They also went on to say that in terms of dealing with the health equity issues, they would be providing supply directly through the federally qualified community health centers throughout the country. And those centers tend to be in minority neighborhoods. And so they believe that they will be able to more efficiently address health inequities. Those health centers will likely have as many as 250 doses. And we should see that ramping up very quickly as well. So that's what we were told on the call right before I came down. And there may be some other details we just, because I had to come here, and perhaps, I didn't hear the remainder of the specific details associated with it. They have not all been identified, but they very well could be the True Health Centers. They could be the Orange Blossom Health Centers. They could be even our own local health clinics. Orange County operates some clinics throughout. So the goal is that they have to be the federally qualified health centers, and that denotes a certain designation, and it will be those within local jurisdictions.
This next question comes in from Matthew Petty from WMFE. This is for Mayor Dyer or Mayor Demings or both. His question reads, this is on the curtails of the domestic travel story. Would either support a potential domestic travel restriction to curb the spread of coronavirus?
Mayor Dyer, he'll speak for himself, but I don't really think that that's necessary at this point. Again, the vaccine is rolling out significantly across the country. Almost all of the metropolitan areas are seeing significant declines at this point, so I don't believe that that's necessary. We have proven that with the domestic travel here and even the international travel, that the protocols that we have in place have been fairly successful, because our experience with the data in terms of the numbers of new cases, we have fared better than many metropolitan communities around the country. So I don't think it's necessary at this point.
Yeah, I totally agree with Mayor Demings that I don't think that's necessary, that we're headed in the right direction and we've taken the right precautions here, and people can make their own choice about whether they're going to travel in the same fashion. They can make their own choice about whether they're going to wear a mask or stay home or do the other pandemic precautions that we have been talking about for the last year. And I also agree with Phil that I don't think that mandatory testing for domestic flights is somewhere we ought to be putting our resources, because we know we have limited resources in terms of both testings and the vaccines right now, and community testing and using the vaccines in the community is more important to me than for travel purposes.
Thank you. This next question comes from Bob Hazen from West 2, and this is for Dr. Pino. Dr. Pino, do you have a total number for how many doses of the COVID vaccine have been wasted or discarded or unused? And have there been any instances of vaccines that have been spoiled?
So the devil's in the details. So other places are reporting, France, England, and others are reporting as high as 20% waste. Just giving you that information, in some cases even more than 20 have been reported. Our waste, what we call waste, is less than 1%. So I know it's hard to believe, even the state has come to check how we do it. So the way that we do this is that we know by hour who is coming and how many people we are expecting. We also subtract from the day before the percentage of no-shows that we have as a projection of what is going to happen that day. And based on that, we pre-draw the vaccines. So by hour, we say we need 100, knowing that we may need 120. And then at the end of the day, we move the drawing of the vaccines to the floor, so where the nurses can see how many vehicles are coming. And they draw by the number of vehicles that are coming. Now, you can have more than one person per vehicle. You don't know that. But you know that at least you have a car. While that person is having the vaccine, you draw another one. So we have minimized waste to the minimum. Now, when waste can happen now is sometimes accidentally when you are taking the air out of the syringe. Nurses prefer that the syringe has a little bit of air so that they can put it right in position to give the shot. Because especially Pfizer is clear like water, and sometimes you can't realize that the vaccine is there. So you have to give the exact dosage. So sometimes could happen that a needle gets broken, gets bended, you cannot switch the needle, the syringe dropped to the floor for whatever reason, or sometimes when you are pushing, you push too much out. And because vaccine cannot be mixed from lot to lot or vial to vial, then you have to discard. And that's when we have that 1%, less than 1%. In a typical day, it's about 5, 3, 4, 7. So it doesn't go higher than that. And even at that point, if we have any pre-draw vaccines and people don't show up for whatever reason, we have always given to our staff that may need a second or first, or sometimes to the people who work in the convention center. Sometimes someone has shown up with someone driving, and we offer the vaccine to the person. And we are in conversations with the county to how to establish a waiting line at the convention center from where this situation may happen for people to have it. So that's a reality.
Thank you. And the last question here is for Mayor Demings from Ryan Lynch in the Orlando Business Journal. His question reads, Mayor Demings, what factors will help locally in ramping up local vaccinations to help meet that federal goal you mentioned?
Um, uh, Here locally, we're prepared. We have all of the supplies on hand, from syringes to everything else, so that when the available supply inventory increases to a level that we can widely disseminate the shots within our community, we're prepared to do that. So we're only limited today by the lack of available supply. Again, the federal government said to us today that they want to get better at working with state and locals to be able to predict when the supply will come into the future. Right now, they're working on a 3-week model. They want that to even improve as they acquire more stockpile and inventory across the country. Okay. It appears that that is the last question, and I just say to all of you, thank you for being here. Thank you to all of the backup that came today to answer the tough questions. If there are any remaining tough questions, Commissioner Uribe is available.